After my training of basic dermatology, by destiny, I became a doctor inside a fitness facility. And at the time, fitness and skin were actually operating in two different departments or facility. But then I thought of why not combine some of the protocol of fitness in body sculpting, which is actually beyond skin. But because I'm not the owner of that fitness facility, and my authority is only within that skin clinic, I thought of creating something that has the fitness protocol combined with the skin protocol, and of course, that brought about the so-called the Zeninstitute. Now, why Zen? You know, whenever I walk into a spa, I really like the ambience. I find it very peaceful, quiet, close to nature, and you can focus more on yourself. And it's that ambience that really brought that Zen Institute ambience. I want that medical spa to have that spa experience. At the same time, it's science-based, it's evidence-based, and so we can't go wrong. After my basic training in dermatology, it was by destiny I was invited to be a doctor and set up a skin clinic inside a fitness facility. It was a great experience, and this actually opened the world to fitness, weight management, lifestyle. Now I thought of combining the protocol of fitness and skin clinic, or rather aesthetic. But of course, because I don't own the facility, there were a lot of limitations. Now, this vision that I have been trying to put in reality, combining the protocol of fitness and aesthetic, now becomes the Zen Institute. The name Zen actually is very striking to me. The reason why we called it the Zen Institute is because Zen means tranquility, peace, and close to nature. And having the natural beauty must only take the non-invasive, non-surgical treatment. In fact, that has become our greatest challenge. We created the Zen Institute, non-invasive, non-surgical procedures at the height of cosmetic surgery. And all our patients are all asking, why non-invasive? Why non-surgical versus the quick fix? Again, if you want to have something that's more permanent, it cannot be quick fixes. It has to be a journey, a step-by-step process, a protocol-based, but again, it needs to yield results. The greatest challenge that we have experienced in creating the Zen Institute was the launch of the non-invasive, non-surgical aesthetic procedure, because it was this time, way back 2005, it was the height of surgical cosmetic interventions. The reason why I focused and actually prioritized the non-invasive, non-surgical procedures compared to the surgical procedure, even when I started, I was doing liposurgery, was because, one, I wanted to integrate the lifestyle. And I want to have more permanent results. If I do the quick fixes, the patient would definitely not adopt a healthy lifestyle, nor will I get the permanent results. Let me share with you one of my patients before and why I really decided to go into non-invasive, non-surgical approach. The patient was scheduled for liposurgery, and I asked the patient to lose at least 2 pounds so that after the surgery, that patient would already adopt a healthy lifestyle. And guess what happened? I lost the patient because the patient would not want to go into a diet plan, an exercise plan, and would rather just have this quick fix of liposurgery. 3 months after, the patient came back to me for another surgery. And so I said, I should create a facility which also offers that healthy lifestyle, that aesthetic procedure, the not quick fix, but rather the non-invasive, non-surgical approach. The first non-invasive, non-surgical procedure that we introduced in Zeninstitute is the non-invasive body sculpting by using mesotherapy technique. When we do mesotherapy protocol to the patient, we also introduce nutritional counseling, diet plan, and of course, exercise plan. When we introduce mesotherapy to our patient, the first thing that we do is we get the BMI or body mass index. We also check the percent body fat. And it is from there that we come up with a protocol. Now we also give nutritional counseling, diet plan, exercise plan, and from there we try to see the frequency of when the patient will be coming to Zen. Based on visual assessment, we also need to focus on where the fat distribution is. The biggest fat distribution is where we put on or focus the mesotherapy. Most of the patients enrolled in non-surgical body sculpting program would usually end up having a healthy lifestyle. Why? Whenever they follow the diet plan, they definitely see the inches loss and they get to wear those size 4 to 6 clothes, coming from size 10. Now, once you have achieved the goal, or once every patient has achieved the goal, then the challenge now is maintaining it. And of course, everybody knows that if you keep a healthy lifestyle, then definitely you can maintain that body. The bioidentical hormone replacement therapy, or BHRT, has really brought in a lot of challenge to us. Since the synthetic hormones has been out in the market and has caused a lot of bad side effects, it was very difficult for us to convince our patient that BHRT, or bioidentical hormone replacement therapy, is totally different and very safe versus the synthetic hormones. We persisted in promoting the bioidentical hormone replacement therapy because this is actually the key to anti-aging. When somebody goes through the aging process, the first thing that goes up or down are the hormones. Aesthetic has always been a part of wellness, but aesthetic is from the outside, and we need to work aesthetic from within. The different wellness modality that we introduced are the IV micronutrition, the detox or colonics, the regenerative cell therapy, and the bioidentical hormone replacement therapy, or BHRT. In its simplest term, the science of stem cell therapy is regenerating cells from within. In the 5 steps to ultimate wellness, it is a regenerative cell therapy which is the most important step. It is the only one which combats aging at a cellular level. But science has discovered other sources of stem cell, and one of it is our own fat. So we don't need the fetus anymore. We simply need our own fat to harvest the stem cell. My father died of cancer at age 60, and my mother had Parkinson's disease at age 65. And so I carry both genes of cancer and degenerative disease. My father died of cancer at age 60, and my mother had degenerative disease or Parkinson's disease at age 65. And so I carry the high-risk genes of both cancer and degenerative disease.